Hi, I'm Dr. Raquel Butler from Integrated Veterinary Therapeutics, and this is Henry, my 6-year-old thoroughbred off the track. Equine muscle release therapy, or EMRT, is a dynamic, non-invasive manipulation of the soft tissue to stimulate the body to heal itself. It works along the fascia, which is the underlying continuous cling film-like layer which covers all of the muscles, invests between the muscles and goes into the internal organs. When the fascia becomes restricted, then it restricts the muscles and organs that it surrounds. This restricts the circulation, the nerve flow, and the lymphatic flow, which is the removal of toxins from that area. EMRT also works along the nervous system, and by working along the nervous system, it means that by working on a certain area, you are addressing other areas of the body, like switching on a light bulb. Horses are amazing creatures and they put up with so much from us human beings, and we take a lot for granted. I believe that no horse, and very, very minimal horses, actually misbehave. Most misbehaviour comes from discomfort or memories that have been created of a bad experience. The most important thing if you have a misbehaving horse is to rule out every other possible area of discomfort before saying that it is a behavioural problem. These sorts of areas can be feet. Foot balance is extremely important in maintaining the balance within the body of the horse. No foot, no horse is the old saying. A balanced hoof promotes a balanced body, and I have seen firsthand the effects that balancing the feet, as well as doing body work, can have on the body. Teeth are another important area that needs to be addressed. If there are any discomfort in the mouth, then it can show up as a myriad of problems, including bit problems, but also including other behavioural issues. So the first thing that I like to have done before I see a horse is to make sure that their feet and their hooves have been addressed and are as balanced as they can be. The other important factor is saddle fit, which I will discuss in a later video. This is extremely important in the comfort of your horse, and even a slightly ill-fitting saddle is not good enough and can cause quite a lot of discomfort for the horse. So it is important to rule out saddle fitting issues, hoof balance issues, feet issues, and then body issues, of course, before saying that there is a behaviour problem within the horse. I'm constantly amazed at what I see horses putting up with, whether it be an ill-fitting saddle or an uncomfortable bridle or a body issue, but they still try their hardest and give it everything that they've got, and we often neglect listening to them and looking for the issues that may be the problem. I think it is vital that you have ruled out all of those issues before even contemplating that it is a behavioural issue, especially if they didn't used to behave in that manner. So ruling out an ill-fitting saddle, having an accredited qualified saddle fitter, a feet problem, a qualified barefoot trimmer or well shod. So the most important thing before even considering a behavioural issue is to rule out all other areas of potential discomfort. This can incorporate hoof balance and ensuring that the feet are adequately balanced, teeth balance and ensuring that you've had your horse's teeth done within at least the last 12 months. Also addressing your saddle fit, and this is crucial to get a qualified saddle fitter out to address the fit of your saddle and to ensure that this is correct. This is covered in another video, but it is important to have your saddle fitted regularly, not just every once in a while, as your horse changes shape quite frequently, and so the saddle fit will change. Things that could indicate that there is a problem within the body of your horse or something that they're dealing with could be as simple as just not flexing as evenly to both sides, or it could be more complicated and be rearing, bucking, refusing jumps, or taking a wrong canter lead. But they should feel balanced and rhythmical and even both ways. And so picking up the subtle differences at an early stage will alleviate the likelihood of breakdown later on down the track. Some things that you can also look for early on in the progression are things like muscle atrophy, so wastage of the muscles, especially in the wither region. This could indicate a problem with your saddle fit. Also looking to make sure that the muscles don't look defined and dry and tight, like this area here, as that can indicate an underlying problem. And lines like this, where you can see a defined line across the shoulder, indicates that you've got lack of circulation, fascial tightening, and restriction of the muscles in these areas, which are going to impede your shoulder motion. This can come from ill-fitting saddles. In his case, it comes from racing. But recognising these problems now can prevent further problems like tendon breakdowns in the future. Also, if they are quite pointy on their rump, this can indicate underlying sacroiliac problems. If they are quite weak and swayed through their back, then this can indicate that they're not using their hind end properly. So picking up some of these subtle differences early on in your horse's life will allow you to have a much longer, happier time with your horse and prevent those horrible injury breakdowns and long-term rehabilitation. I'm Dr. Raquel Butler and this is my horse Henry. I'd like to thank you for listening to me today, and if you have any further problems that you'd like to discuss or issues with your horse, then please give me a call or contact me through my website. Thank you.